This is a tutorial for functional range conditioning, loaded or level 3 spine cars, controlled articular rotations. Within the functional range system, we use cars to maintain the health, mobility, and longevity of our joints. This video is not for someone that is unfamiliar with how to do spine cars. So I'd like you to go back to the tutorial if you don't know how to do spine cars and learn how to do the movement, which would be considered a level 1 spine car. Level 1 spine cars has a mobility focus, meaning we're learning how to use our joints in their end ranges of motion of rotation. Level 3, or loaded spine cars, has a capacity focus, meaning we're trying to increase the neural drive into the tissues. We're trying to increase the load-bearing capacity and the strength of the tissues that we are using to do the spine car. There's a few different setups that I'll show you for this, depending upon the equipment that you have at your disposal, and you can pick whichever ones you like best. They all have something to offer. So let's get into it. So let's get into our functional range conditioning, level 3 loaded spine cars. The first object I'm going to use is going to be this large exercise ball here. Now, it doesn't really matter what the size of this ball is, but it needs to be pumped up really firm. This can't be too squishy. The setup for this is going to be placing this on my chest pretty high, so kind of right into my pecs. And we begin the spine car first by squeezing into the ball with my arms, like I'm trying to hug it into myself. And we'll start with flexion of the neck, continuing into flexion of the spine. So I'm going to use my abdominal wall to squeeze down on this ball really hard. From here, we go into our end range of motion of side bending lateral flexion here. Transition into rotation, and then pull up and back into spinal extension as far as you can go. Come across your midline, find your end range of side bending lateral flexion, end range rotation, pull back into flexion and back to your midline, and then you reverse to the other side. We roll back up. So that's a nice option for a level 3 spine car. Our second option is going to be using a medicine ball or a wall ball. This one's 10 pounds, but you can go quite a bit heavier. Again, we're thinking about training capacity of the spine, driving more of our nervous system to get into the movement and starting to add a load-bearing capacity into the spinal joints. So this is going to be much the same as what we just did. I'm going to pull this high up on my chest, and I'm going to go into my flexion of the head and neck, flexion of the spine here, side bending the spine to my end range of motion, end range rotation, up into extension, coming across the midline, side bending lateral flexion to end range, rotation, coming down to the floor, and then reversing. And we roll back up. Next option that I like to use for level 3 spine cars involves the use of a band. Now this is a pretty long band. You can use varying thicknesses for more tension of this. The first setup for this is I'm going to step into the strap like this so that my feet are pinning down the bottom of the strap. If I want more tension, I can step further out into the strap to create more tension on the band. Now the position of this one, once I've stepped into the strap here, is I'm going to pull this up and back behind my head and neck. I want this on my trap muscles on the top of my shoulders, not kind of right at the backside of the neck. We go through the same spine car here, where I'm going into flexion of the neck, flexion of the spine, lateral bending, side bending, end range, rotation, up and back, crossing the middle, side bend, end range rotation, into flexion, back to the middle. Our second option for using this is the same thing. I'm going to step into the band with my feet, and instead of placing it up behind the back of my neck, I'm going to put it into the bend of my elbow joints. So I've got tension on the band here, and I'm going to pull this band up with one hand, put it right at the bend of the elbow here. I'm going to bring this one up and put it in the opposite elbow like this. So now I've got the band kind of draped across my elbows like this. I'm going to step out for more tension, widening my stance. Arms are crossed. Same spinal car. End range flexion. End range lateral flexion with rotation. Up, 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 up. I'm really working against this progressive tension here. So the further I go up, the harder it gets. Rotation into flexion, and then reverse. Now, if I want to work this a little harder, I can load this more. So what I'll do is take the same ball that we used, this medicine ball, wall ball, and this can be a little tricky to set up initially, but I'm going to step into the band, same way that I just did. I'm going to start with holding the ball in the opposite arm while I scoop my elbow down and into this band. Then I transition the ball to the other arm, and I reach down, scoop my elbow into that band like that. Now I've got both progressive tension of the band and load of the ball. Same spine car, flexion, side bend, rotation, up, 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 up. And this just got a good bit harder. So really working the capacity of the spine to tolerate these loads in flexion, rotation, side bending, and extension. Nice. The last option is going to be using more weight than what that ball can offer. And what I'm going to do is use, in this case, a 20-pound kettlebell. And the 20-pound kettlebell is going to be pinned to my chest with my arms bent like this. So we'll go through the spine car here where I've got to keep myself really tight, really engaged through the core as I pull into flexion, side bend, lateral flexion with rotation, up, 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 back, cross my midline, side bend, rotation, down into flexion. And I'm keeping my core real tight here. I'm not letting anything shift. And then this can also be used in a hanging position here. So I can hang this down like I would start a kettlebell swing, and I'll let this draw me into active flexion using my abs, side bending, rotating, pulling that belt up and back. I feel this load a little more in my lumbar spine than the one we just did. The one we just did, you'll feel the load a little more in through the thoracic spine. So this gives you some nice options to start to train a level 3 loaded spine car for more capacity. So we're trying to strengthen through that active range of motion, through that end range of motion, access more of the nervous system to squeeze into those muscular tissues. So play with all these setups. They all have something to offer, and I recommend you try them all based on what equipment you have access to. Great job, guys.